Osteoporosis.
Fracture and treatment.
Osteoporosis is a disease of the bones. It happens when you lose too much bone, make too little bone or both. As a result, your bones become weak and may break from a minor failure. In serious cases, even from simple action, like sneezing or bumping into furniture.
Osteoporosis means porous bone. If you look at healthy bone under a microscope, you will see that parts of it look like a honeycomb. If you have osteoporosis, the holes and space on the honeycomb are structure of your bone tissue has become abnormal. As your bones become less dense, they also become weaker and more likely to break. If you're age 50 or older and have broken a bone, talk to your doctor or other healthcare provider and ask if you should have a bone density test.
Now, let's talk about the symptoms and risk factors that can lead to osteoporosis. Some people have spine fractures that lead to a curve in their upper back. The first suggestion of spinal fractures and one of the first symptoms of osteoporosis may be when you realize you are not as tall as you used to be. Other signs and symptoms are back pain and stop posture. If you have lost more than 1.5 inches from your height as a young adult, you may wish to speak with your doctor about testing for osteoporosis. The risk factors are getting older, being small and thin, having a family history of osteoporosis, taking certain medicines, being a wind of Asian woman, having osteopenia, which is low bone density. About 54 million Americans have osteoporosis and low bone mass, placing them at increased risk from osteoporosis. Studies suggest that approximately 1 in 2 women and up to 1 in 2 for men aged 50 and older will break a bone due to osteoporosis.
Now, let's talk about the treatment of the osteoporosis. Kyphoplasty. Kyphoplasty is a minimally invasive surgery used to treat a spinal compression fracture. Spinal compression fractures occur primarily in spinal vertebrae that have been weakened by osteoporosis. Compression fractures typically occur in the thoracic region of the spine, which includes the T1 through T12 vertebrae, but may also occur in the lumbar spine or L1 through L5. The goals of kyphoplasty are to reduce pain through the fracture, stabilize the vertebra, and restore the vertebra back to its normal height.
In the procedure, the patient lies face down on the operating table. The surgeon makes a small half-inch incision over the affected area. Using X-ray guidance, the surgeon inserts a narrow tube through the pedicle into one side on the fractured vertebra. In kyphoplasty, a balloon tube is then inserted through the tube and into the fractured vertebra. Once inside the vertebra, the balloon tube is inflated to create an open cavity inside the bone and to restore height to the collapsed vertebra. The surgeon then deflates and removes the balloon tube from the vertebra, leaving the new bone cavity behind.
A plastic compound called PMMA, a type of bone cement, is injected into the cavity until this is full. The cement hardens quickly, creating an internal cast inside of the fractured vertebra. The process may be repeated on the other side of the vertebral body to ensure uniformity and increase the chance of complete deformity correction. In other forms of kyphoplasty, other surgical approaches for creating the cavity may be used, such as knit or ball. The surgeon then closes the incision. The patient stays on the operating table while the cement hardens, which usually takes about 5 minutes. Most patients can go home the same day as the procedure.
How to prevent osteoporosis? Osteoporosis is a silent disease. You may not know you have it until you break a bone. A bone mineral density test is the best way to check your bone health. To keep bones strong, eat a diet rich in calcium and vitamin D. Exercise and do not smoke. If needed, medicine can also help.